Good morning, everybody. It's our weekly webinar, and before we actually launch and really get things going, I just would like to get a couple more confirmations that people can hear us. I have a mixed bag of some people that can hear and some can't, so hopefully I see more yes, we can hear, so we can get started. Okay, I think we're good. I'm seeing yeses, so that's what we want to see. So we'll get things started. Okay, so our agenda for today, first off, we're going to talk about a change in our webinar frequencies. And we did hear a lot of feedback from care managers that although, these meetings have been helpful ways for us to communicate, we think now is really the time for us to go to every other week. And we'll go through kind of the process for how we're going to update calendars shortly. Jim Moran is going to do a CEO update. Then we're going to have our focus on care management priorities and updates. We're going to talk about Tier 4. We're also going to go over some information that we'll be sharing on IM interviews. And we will have our typical Metasced updates with Lori. Devin will be joining us quickly to do an IT update. We also are going to have a compliance update from Lisa Getman, a healthcare update from Dr. Byron, and then we're going to update on the Chromebook focus group, and we're going to have another update, which really hasn't been a lot of progress on the Maximus CAS assessor issue. And then we will have our usual shout-outs. Okay, so just really quickly, we're making a change to the webinar schedule. We're going to continue doing them 9 a.m. on Thursdays, but we're going to start doing every other Thursday. So after today, next week, September 27th, we will not have a webinar, and then we'll proceed October 4th and every other week doing the 9 a.m. care management webinars. And we will update people's calendars with the meeting notice to reflect that change. Okay, I'm going to turn it over to Jim Moran.
Oh, great. Okay. Thank you for that, Megan. So hi, everybody. It's actually great to be back at Southwoods today. Although we had a lovely trip, Ann and I were down on Long Island, and thank you. Shout out to all the Long Island staff for putting up with us for 3 days or 2.5 days. But we really had a great time. It was really great to see everybody and meet everybody. And Ann has packed our agenda. Travel agenda. We're going to be out and about over the next several months, out meeting everybody, and it's really great, and it's really very uplifting to meet everybody, to really feel the enthusiasm that staff have. It really does help us a lot in terms of as we think about our day-to-day things here, to really see the staff energized in what they're doing. So thank you, Long Island. It was great to meet everybody. So the rest of you, we will be out and about, and we'll be coming to your neighborhood soon. So just hang in there. I just wanted to touch base a little bit on compensation updates. In our trip to Long Island, we were starting to get asked about, oh, by the way, when are those sign-on bonuses going to get paid? Because there's a number of staff who are approaching their 90 days with Care Design, the care management staff. So right now we anticipate those payments to be made on or about October 5th. It will be in a separate check. Or deposit, depending upon your banking situation. Will be made to you. So again, for those of you who have just started, remember it's 90 days. So it's after you've completed 90 days employment with Care Design. So that compensation will be going out shortly. Okay. In terms of the future, the other thing that we've started to talk to the staff about is obviously, we in setting our budget, not knowing full well where we would be organizationally, didn't know what enrollment was going to look like, didn't know what revenue would look like necessarily. And quite honestly, we've only had 2 months of experience at this point, 2.5 months into operations. So one of the things that I just want to make sure that everybody understands is that our goal is to invest in the workforce, and we continue to do so. So as we evaluate our financial situation here at CareDesign, I want to make sure that any resources that we have available, that we want to reinvest in the workforce. You are our greatest asset. We rely on you. You're the face of the organization every day, and we value you, and we want you to stay at CareDesign. We want all of our employees to stay with CareDesign. So we are going to be, by the end of the year, we will have evaluated where we are financially to see what it is we can do from a compensation perspective. That is not a promise that we're going to do something. It's a promise that we're going to evaluate and see what it is we could possibly do around compensating the workforce a little better. Now, that could take the shape of salary, could take the shape of a bonus payment, could take the shape of benefit modifications, any combination of those things. One of the things that Ann had mentioned is that when we first started in trying to put together our plan, our salary plan, we looked at experience a certain way. We looked at secondary or postgraduate education a certain way, and maybe some of that, actually through the staff coming back to us saying, could you look at some of this maybe differently? So part of what we'll be examining will include that as well. So Ann and I will work with Lisa Reese and Charlie, our CFO, on looking at the various aspects of this. Now, again, I'm not promising anything at this point other than we're going to be looking at this. We know it's important, but I just want to make sure that everybody understands we value you, and we have obviously high expectations in terms of performance, and we need to be compensating appropriately and be as competitive in that area as possible. So I just wanted to put that out there that, you know, this bonus payment that's coming out is not a one and done thing. And our goal is to do the best we can going forward to recognize the value in the work that you do every day. So that's it.
Thanks, Jim. And I know Ann Ogden wanted to say a couple
Yes, go
words.
ahead.
Yeah, I wanted to, again, thank everyone in Long Island for taking out time to meet with us, and we loved coming out to all of the different sites that you're currently working at. I wanted to just highlight some takeaways, and I know that it'll continue as we go out to the other sites, but I think it probably, resonates with many, many of our sites, no matter where you're located. One of the takeaways that we're hearing loud and clear still is the challenge with technology, and I think we might have thought we were a little bit further ahead than we were. And by technology, I mean printers that are they're not set up for the volume and the kind of work that you're doing. So we're going to be working with IT to really evaluate that and make some changes and maybe put some additional units out. We saw that visually, and we heard it loud and clear. So we know we have work to do on that. Getting everyone fax capability, we know how important that is, and we're not as far along as we need to be. Challenges around phones. It's great that the agencies allow you to use their systems, but when new staff come on, they're without a phone. So we really need to be resolving that issue and making sure that individuals, employees have phones. The IM assessment and Metasched, we're well aware of those issues and currently working on them, but people were very good in terms of showing us firsthand and talking to us about how that impacts everyone on a daily basis. And then also the concern you have about adding the IM assessments to an already packed schedule, and how are you going to fit those in, and really looking and examining what we can do as an organization to support you in the best way so that you're feeling successful. Another thing that, Jim and I were out in Long Island looking at alternative space, and we've been doing that throughout the state, and we'll continue to do that. So really looking at prioritizing who's not the most ideal space with connectivity or with the actual physical space you have or the resources you have. So, we're looking at that. We're committed to not making you travel a long period of time. Some people are really excited because it'll be less of a commute for some of the, options that we might have available. So it's not just exclusively to Long Island. We have many appointments all over the state in terms of looking at getting care design staff into care design spaces so that you have all the tools and resources that you need. And your regional care manager directors will continue to update you on that. We'll update you on that so that you know kind of what's coming forward. But it's, also it's always about a 4 or 6 month lead time in terms of actually making those changes. But we're very committed to doing that. 2 other quick things, we get mixed results on the webinars. I'm happy that we're going to do them every other week. We've heard loud and strong. We love the training you're giving, but you're training us to death. So we really need to kind of look at, especially as you're going to do the IM assessments, prioritizing those, getting those available to you quickly on Litmos, organizing them in a better way so that you know what you're looking at, and taking better notes and feedback so that you get some written material, which probably won't be happening for today because we just got back, but we're really going to be committed to that. And the last thing I wanted to mention is just an aha moment with, people were concerned about floating holidays and when do they expire, and they expire at the end of the year on December 31st, the floating holidays that you get. But just a little tip, if you use your floating holiday time before your PTO, you still have the same amount of time and you're not in jeopardy of losing anything. So people kind of hadn't thought about that, and I just wanted to put that out. That's a way that you don't have to worry about losing your floating holiday time. You still your time. Doesn't matter if it's holiday time or PTO. You can use it the same way. So use your holiday time first. That's it.
Okay, thanks, Sam. Okay, so care management priorities, and I know we've discussed this the past couple weeks, but it continues to be even a higher priority now that we're past the midpoint of September. So face-to-face visits. Everyone knows they must be completed for individuals that are in tiers 1 to 3 who have not had a face-to-face contact in July or August. And it's really critical that these get done as soon as possible. We all know that's a requirement. We need to be providing care management, and doing the face-to-face visit is really a critical way to connect with the individual we serve. So please make sure to get your visits done as soon as possible. And next quarter, we're going to do some planning ahead to not be in the spot of having so many visits still due the last month of the quarter. And your supervisors will be, I know they already are, but they'll continue to be following up with you on ensuring face-to-face visits are completed. We have seen that there were some visits, and we've heard that there were some visits done in July or August. There's a note in Metasched, and it didn't translate as really counting the face-to-face visit. The in-person box may not have been checked, or maybe it was, and there was some type of glitch like we had in July. So in those situations, supervisors will be gathering that information from you and working with the regional care manager directors, and then we'll be working with Courtney in our quality and data analytics unit to compile that and to go back to Metasched and see what we can do really on the back end to make that more of an automated, easy process with those things that really were done appropriately and accurately and just not recognized by the system. So more to follow on that, and please make this your top priority. Okay, just a quick update on Tier 4. We continue to work with the other CCOs and OPWDD, and we will be coming up with some talking points internally for care managers. We're aiming for the end of next week. And Jim, I don't know, do we have any other update on that?
No, we still don't have a final, I think we talked about the memo that the state had put out to us in draft to take a look at. We wrote a letter back last week to them about the information that they provided us, and had made some additional requests in there. We have not heard. We have a call with them tomorrow, so we may get more information tomorrow. But one of the things, I don't know if we talked about this, Megan, is that one of the things we've asked them to do is to not have Tier 4s changing every month. So that's a challenge for any of us to be able to manage, and for you and the disruption, the potential disruption. I think they're open to that where that would possibly be done more on a more scheduled basis. And hopefully that'll be in the final memo. But I do know they are sympathetic to that issue of recognizing that we don't have the ability to manage this every month. The first 2 months, we've had roughly about 60 people, I think roughly on average, Courtney, I think something like that have changed from Tier 4, either into Tier 4 or out of Tier 4, which is a significant challenge to manage. So I think it's going to go to some other time period and when they'll be doing updates to, minimally to Tier 4. So hopefully tomorrow we'll get more information.
Okay, so more to follow on that, everybody, and we will be working on getting you information next week. Okay, just really quickly, I know there's been a lot of questions about how to convey what the IM interview is to individuals and families in a way that they can understand, how to answer their questions. So we did consult with Jan Abelseth, and Suzanne Beatty from our quality department kind of took a shot of taking information Jan put together and worked on a brief PowerPoint that we think could be helpful to care managers in your conversations with individuals and families about the IM interview process. And we can also obviously share that PowerPoint with them as well. So we do want to get your feedback. If that isn't something exactly that you find helpful, if there's something else we can focus on, please let us know. And we are also going to be working with Jan to put together a short video with a family member that she had in mind that's already gone through the IM process, and do something along the lines of a, care manager with the family member kind of talking it through. We thought that would be helpful maybe to have on our website. And so that's going to be a work in progress. It'll take us a little bit to get that together, but it's another thing we do intend on sharing to support people.
I just wanted to say one piece on that, Megan.
Sure.
You heard Megan refer to it as an interview. I don't, and that was at my doing, I don't like the fact that this is called an assessment, because that really scares individuals and families, because they think of other assessments. This is really a discussion that takes place with the individual and family. Of course, it's a lengthy discussion. It takes hours to do it, but it really is not, I don't really think it's truly an assessment. So we're kind of changing the wording around a little bit, so that could get confusing. But I just wanted to point out, we refer to it as an interview as opposed to the IM assessment.
Okay. So our next topic is Metasked, and Lori's going to give us some updates.
I feel like we should have music, like dum 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 dum.
You need your own theme.
I should have made a special slide for this too.
Drum roll.
Intro music.
No pressure, gosh. I was driving in this morning going, what am I going to say? I don't have that much. And there's Ann kept talking, and the list got longer. So, Ann, you need to go back on the road.
I'll help you out.
Yeah, that's what I'm afraid of. All right, so let's start with Lessons with Lori. We have been taking your cards and letters and keeping track of all your requests. So this week, shout out to Scott Cohn for jumping right in with both feet and explaining what the personal outcome measures are, because that's the kind of the end goal of the IM assessment as far as the technology is. And
Interview.
I'm sorry. I actually prefer the word conversation.
Okay, that's good too.
But and one thing I want to say about that interview conversation is try not to let the technology get in your way. The technology is a way to capture the information. It's not a way to do a life plan. And what you're really trying to do is learn something new about the people you've been supporting for years. Making sure it's all documented, making sure that if you fall off the face of the earth tomorrow, somebody can pick up where you left off and all the information is there, and learning something new. You could be supporting somebody for 10, 15 years and learn that their favorite color was pink, and you never knew that because they always wore black, So I'll get off my soapbox. But anyway, to continue to help you guys better understand this entire process, our On Deck with Lessons with Lori is next week. Dr. Paul Byron is going to explain to you what care managers and the flu have in common. I'm going to leave that out there as a teaser. And he's like on it all over. I see his facial expressions. We're going to work, Scott doesn't know this yet. If you're listening, Scott, we're going to bring you back in, and we're going to ask him to do an hour on how to conduct interviews. Palms interviews is his background. It's still a conversation, and he's going to give us tons of techniques and help us walk through that. We know that people are dabbling out there on this concept of interdisciplinary team meetings, so we're going to find somebody to help kind of talk about what facilitating that works. We can bring in some people who've had some success and some failures. So if you're one of those, email me and we'll put you on the panel to help talk through that. And then finally, there's this thing lingering out there called staff action plans. And eventually they're going to start coming in, and you guys have to understand what they are. So we're going to work on those kind of topics, which puts us almost to the end of October, folks. So we're on a roll. I know Ann and Jim must have heard a lot about the IM assessment and going into life plans, and I know I've heard it and makes my head hurt. Besides the locking up part, which we are on top of and we're monitoring and we're documenting where they're locked, what location, the frequency of the locking up, we suspect it's an internet and a server issue and not our server. So we're tracking that and we're on top of it. But the other point is, if you were to look at the IM assessment by itself, just doing that app is simple. It's the getting what is needed to translate into the technology in Metasced that's the complicated part. And I know folks have been asking our team for help, and please be patient because this one is something we can't pick up and fix right away. We actually have to go in and look at your assessment, figure out what is missing and what wasn't captured, and then test it and then come back to you and say, this is where we're missing. And we're looking at trying to figure out some ways to better help with that process to get the 2 blue, 3 gray lines. But this one's taking a little bit more time than we thought it was going to. But just keep in mind it's the thing. But one piece of advice I'm going to give the group out there is the ultimate record is the life plan. So one thing you can help with your workload is don't put all the contacts in the IM assessment. So if you have 20 contacts for an individual and it doesn't auto-populate to the IM assessment, don't retype it back in there. It's already in the life plan, and the life plan is the record. So save some time with doing that. That's one thing you can take off the table and off your list. And we'll figure out where other ways, as we've been talking with the team internally, that maybe we can streamline what goes into the life plan you type in there versus the IM assessment. But the contacts is, I think, a no-brainer on that particular one. We also have heard that parents are really very sensitive to what the content of this conversation is going to be about the IM assessment. And what we are working on to help you guys is to develop a completed IM example so that we can print it off in a PDF form and show folks what it's going to look like. And that at least is going to give them kind of a feel for the kind of questions you're going to answer. We know we can't print out all 2,000, but we can get you a sample. We're hoping that's going to bring some comfort and make your job a little bit easier. Two more quick things. We know, based on what we've learned by the end of this quarter, that there's a lot of reporting and information that's not coming to the care managers or the supervisory team very clearly. We are meeting with Metasced almost daily. They're going to be on site next week. We're working with them to get everybody in all the departments the reports they need to be able to manage the quarterly requirements for all tier levels, including state pay, private pay, et cetera. So that is a much smoother, easier process. And we don't want to lose Courtney from running all these reports over and over again, but she's excellent at it. So hopefully next quarter at this time, things will be smoother. And one final thing, we're working on changing access levels and streamlining the access levels in Metasced. So if you log in one day and you find out that something you were poking around in before you can't get to today, it probably isn't a break in the system. It's probably something that we tightened up on the access levels. And we're also going to start tightening up on when new hires get access to Metasced. It is a ton of PHI, so it's not going to be day one you get your access level. It'll be you'll have to complete like a HIPAA course and then you get your access level. But in the background, people will be there, and we can talk about later on with the care management team whether or not we should be signing caseloads prior to them having access. But that was a lot, thanks to Ann's list. That's it.
Well, I just wanted to say, put Lori on the spot, because Jim and I, as we went to all the different sites, we heard again and again and again how thankful they are for Lori. It was, of anyone on our entire team within
I was
Care Design
jealous.
New York. I know.
I was saying, wow, damn Lori.
Lori came up as
Lori,
the most
Lori,
popular
Lori. I
and
know.
appreciated Care
When you-
Design New York staff.
So when you have that compensation conversation.
Don't put those two
All
things
right.
together.
Well, I just want to say it's because of your positive attitude and humor and the
Right.
metaskeletons and, all
Oh,
that
yeah.
stuff. It's the way you explain information, and by far it was your responsiveness.
Right. Oh, yeah.
People were so impressed at knowing how much you have to deal with, that when they're locked out of an IM assessment and they've got to get there in 20 minutes, you unlock them, and they are
Right.
eternally, and I know it's not perfect, you're not at your desk waiting to unlock people, but they know you're committed to them, and that
Thank
went
you.
a long way.
It was
So
great.
thank you.
And I can't do what I do without a team. There's tons of people I'm having conversations with constantly to get the answers and to fix things. And thank you for the team who reminds me to actually eat lunch.
Thank you, Lori.
Thanks, Lori.
Okay, so Devin, are you on the line to do some IT updates? Okay, I will cover the IT security safety reminders, since I don't think Devin's connected. So
Or he
just
can't
to-
speak.
Or maybe he's muted, I don't know,
He
not
might not be
purposely
muted.
either. So
He's been
first off-
Mindcast. Sorry, I couldn't help.
Oh, boy, derailed by the CEO here. So, phishing emails. I know that many people have gotten some phishing emails earlier on, and as a reminder, just use caution when you're opening any emails. If you don't know who it's from or what it is and you're not expecting it, do not open it, reach out to the help desk or delete it. And then speaking of Mimecast, so also Mimecast attachment protection, just continue to use the Mimecast. It's important because it helps to keep our IT platform, I guess problem-free essentially, and make sure that we don't get any type of phishing coming through that way. So just use caution. Also, anytime you're opening any files electronically, it's really the message that Devin wanted to have conveyed.
We did hear again, the last couple of days, again, the challenges of the security, and particularly with OPWDD. It seems like, however the issues are, particularly at OPWDD, of being able to open documents, that was continued to be heard yesterday and the day before when we were traveling. So we're going to have a follow-up conversation with Jim and Devin about this in terms of what
Alternatives.
Yeah, what we can do here.
Great.
We know we need the protection, but is this the best solution for us? I think we got to look at that.
Okay, so continuing on with a related topic, Lisa Getman is going to do an update on texting and personal health information.
Okay, so there is a very nice text message on the right-hand side of the screen. Thank you, Danielle. So just a reminder that when there are text messages going on, and we certainly understand that it's the preferred communication a lot of times with both families as well as the people that we support, but you cannot text PHI because texting is not a secure method. So, in this example, we have somebody asking the care manager for a social security number, and the care manager, says, no, but I'm going to give you a call. And they want to know when their doctor's appointment is. And so it's another text message back that they can't release that information either. And then, of course, care managers, they're the best. So just a reminder that texting is not secure. I thought it was the WhatsApp app, but I did check. It's just a WhatsApp. But that's also not a secure method to exchange PHI. And I know that there are some people that are using that app for communication. So again, you can certainly use it for communication as long as it's not PHI within that. Texting can and should only be utilized for communication, not including PHI. So just some reminders on what PHI includes. Protected health information, we're all used to it being medical information, doctor's appointments, medications, diagnosis, but it also covers demographic information, date of birth, address, Medicaid number, et cetera. So just a reminder about text messaging. If you were using an app in your prior organization before coming to Care Design and families are using it, if you could let me know which apps those are. I have been in communication with Jim Brown so that we can look at hopefully a platform at some point that will be secure, but if there's something that you're used to and you want us to specifically look into, feel free to shoot me an email and let me know which one, and we can add that to the list to review. With email encryption, just a reminder to put the word encrypt in the subject line in order for your email to encrypt. If you are emailing from your Care Design email to another Care Design employee, that is secure. So you don't have to worry about encrypting anything within Care Design. But anything outside of a Care Design New York email, that includes OPWDD, families, people we support, but where we're finding it the most is other providers. So if you're emailing a JHAB or a ResHab program, or a job coach or a ComHab worker, those emails all need to be encrypted if they contain PHI. So when PHI is not sent securely, and whether that's through text, email, or any other form, we are in violation of both our security policies as well as state and federal laws. There is penalties and fines that can be levied, especially if there's a breach. And just a reminder, if you need to report a privacy or security breach, you can always contact myself, and Jim Brown is the security officer. You can contact him as well. We are going to be doing some additional training through Litmus. It will be assigned to all staff in regards to texting as well as email encryption. So that will be forthcoming within the next week or two. So you will be assigned a course, and feel free to let us know if you have any questions.
Thanks, Lisa. Okay, so continuing on, we're going to have a quick healthcare update with Dr. Byron.
So good morning, everybody. So Lisa already introduced the topic somewhat. We're going to start to talk about influenza next week. The third little blip there is that the upper respiratory season is here. It's already started. We don't have any flu yet, but we're getting close. And the season is once again sponsored by that perpetual source cesspool of germs, school-age children. They'll be spreading them around, bringing them home to all of you, and then you'll bring it all into work, and we'll have viral colds and flu spread all over the place. But the importance of that is that people in large groups in proximity are the vector of these kinds of things, and then just by the fact that we work where we work, that's always going to happen. We have day programs, we have 12-person residences, we have 20 staff floating in and out. All of those things put our population at risk for upper respiratory illness. And this stuff is still important. Illnesses, immunizations, all still important. Historically, we've been through centuries of history, contagious disease, even my childhood, polio, and remembering the beginnings of vaccines and shots and sugar cubes and things like that. Jonas Salk coming up with a special edition of the polio vaccine. And the end point of that is that most of those rampant diseases that we've seen all those decades that cause severe illness and death are mostly controlled in the modern vaccine culture, although we have people arguing the legitimacy of vaccines and some of the things that might be the side effects. In general, we've controlled most of those diseases, and our general world population is much healthier because of it. Center for Disease Control, the federal agency, great website, describes vaccine schedules, both for children and then vaccine schedules for adults. Many of the people that we take care of are going to be in the adult kind of category, and we still have to pay attention to those immunizations for those folks Hepatitis is still in our population. There's a new pertussis vaccine. You see pneumococcal all over the television. Of course, they're trying to sell it. The flu vaccine is important. Every year, we talk about flu vaccine and the problems with flu vaccine. And then shingles, which is, sometimes pretty devastating, a recurrence of chickenpox. There's a vaccine out there now, herpes zoster vaccine. Vaccine schedules change occasionally. Some of the reasons they change are that immunity can change over time. Sometimes you lose immunity. The organism can change. We have a new pertussis organism out over the last 15 years. Flu organisms change all the time. We change our flu vaccines every year. And then some diseases have been controlled or eliminated. We're glad to see those things that are only minimally present in the world. In our country, you don't see much mumps anymore. So the vaccine program for mumps has been pretty successful. Sometimes there's less than a couple hundred cases per year of mumps, which is a good goal for us. And then we've added vaccines to recognize, some of the things that are problematic for us. Now all kids get Hep B vaccines. Kids for the last 25 years got chickenpox vaccines. Adults get herpes zoster vaccines. And it still remains a problem because every once in a while you get some newsworthy outbreak. We had SARS a while ago. We had Ebola. We continue to have sometimes some life-threatening influenza epidemics. You hear about those things through the news. And the future of and prevention and treatment of the research done in universities and drug companies and medical labs, we're hopefully going to have universal flu vaccine, a Hep C vaccine, a Lyme's vaccine, an HIV vaccine, a respiratory syncytial virus vaccine. All those things are still in the works. So this is just that reintroduction to the fact that immunizations still remain important to us for all those diseases that are out there. We're going to talk a lot more about flu and the specifics of flu and some of these other vaccines starting next week. Thank you.
Thank you, Dr. Byron. So,
Everyone go wash their hands.
Join Lessons with Lori next week for Dr. Byron doing further updates on influenza. Okay.
Does that mean we're not going to have bring your daughter to work? Dr. Byron, we can't have bring your child to work?
Masks.
You can wear a mask.
You have to wear masks? Okay, I'm just checking. All right. All right, I'm just checking. All right.
It's safer to bring your pet to work.
Chromebook,
Okay.
everybody's favorite topic. Switching gears here. So I know we discussed on a past webinar that we are going to be doing more work around the Chromebook and trying to see how we can improve the functionality. And we are going to be convening a Chromebook focus group. Many of you volunteered. I think we're up to like 16 people that are going to be meeting with Colleen and Nancy and Devin and some other IT reps to go through specific challenges with the Chromebook. There's going to be some, obviously, brainstorming on some solutions. Devin and the IT folks have been working on a couple proposed solutions that they want to test in a staging environment with the people on this focus group. And then we'll see how that goes and look to hopefully rolling out some solutions from this. So that will be the 27th, next week, the focus group. So more to follow, hopefully, within the week or two after that in terms of, what progress we make with that group. Okay, I'm going to turn it over to Suzanne Beatty and Courtney Ortiz on quality and data analytics.
Hi, everyone. This is Courtney. We just have a few quick updates to share with the care management group. The first is within Metasched, you probably noticed over the course of the last few months duplicate accounts. Matt Northrup's been working pretty diligently on identifying the accounts and sent a first batch over to Metasched, which were merged last week, I believe. And then, of course, over the course of this past week, we have found more. So a second batch will be going in, I believe, next week for Metasched to merge. So this really shouldn't impact your day-to-day other than when you're searching for an individual, always search by active only. And also know that if there was documentation in those two duplicate accounts, they should be merged into the real account. All of your activity should be there. If you're seeing discrepancies, please send it our way so we can look into it a little bit further. Quick update, we started a focus group on those fabulous tasks in Metasched and the drop down that you guys search through and try to find. So big shout out to all the care managers from all over that took part in that. Always looking for more. I think I started out the meeting by saying, I don't think we need to go through every single task on this list. And I quickly realized we needed to go through every task on the list. So we have a second meeting set up for next week to finish the tasks. And all of the care managers were really great. They kind of took it outside of that meeting and have been sending me recommendations. So we're not sitting there in a meeting going through each one. But hopefully we'll have recommendations finalized next week that we can send to the rest of the CCOs, and then hopefully ask Metasched to develop a way to organize the tasks a bit more, have an easier way for you to search for tasks, and we even talked about resources for you so that there's like main categories for tasks, and then you'll understand what might fall under those certain tasks for more specific activities to be documented. So more to come on that. And this is just kind of a request, more or less. You know, I think data can only show us so much. And when meeting with Suzanne and Matt, we really want to hear from you guys about, you know, the struggles you might be facing or maybe complex cases that you may be having, where data might show us population-related things that we can identify resources for. But from you is where we really hear the day-to-day struggles. So we kind of want to be able to develop resources for you and be a support to you. And we recognize the anecdotal information is just as important as the quantitative. So send them our way. No issue is too small, and just know that if you're struggling with something, there's a 100% chance someone else is too at Care Design. So we want to support you in that. That's it.
Thank you, Courtney.
Thank you.
Great.
Okay, the CAS assessor issue. We continue to not have any update or resolution. And again, you know, once we do, we will let you all know. We're in a holding pattern here, and I'm not sure actually when we will have an update. Jim, any?
No, I mean, we have a call tomorrow. I'm sure if it's not on their list, it'll be on our list, asking them what's going on again, and we'll see. But it's amazing that this continues to kind of fester out there. I'm not sure what's going on.
Okay. All right, so we're going to go to shout-outs. So we'll kick off shout-outs. Ann, you want to do the first one?
Sure. So this is for Janet Byrne, care manager in Poughkeepsie. Recently, she was visiting one of the individuals. She overheard something that was of great concern. Some of the individuals that she did not directly support had been having a lot of difficulty regarding transportation and rights violations, at least possibly rights violations. She asked questions, she learned about the issue, and it had been going on for a very long time. And though it had been addressed before, it was not corrected. So she placed a call to the Justice Center to advocate on behalf of the individuals. And she just received word that the issue is being investigated and corrected thanks to her efforts. She is a tremendous advocate, not only for those that she supports on her caseload, but for anyone in need. And that was from Courtney Staller, the care manager director down in the Hudson Valley.
Okay, Jim, you want to do this one?
If I gotta be able to read it. Sorry.
As big as I could do.
No, I had to see the screen. Hey, I know, come on now. All right. So this one is for Teresa Williams, care manager in Brooklyn, for her outstanding work with keeping 2 Willowbrook class members together while pursuing alternative residential services for both individuals. That's great. Trying to keep folks together who want to be together. That's what it's all about. The 2 gentlemen spent years together while in Willowbrook as roommates. They were both subsequently in the same IRA setting, and after many years in that setting, the setting was no longer meeting their needs. The prospect of separating them while pursuing alternative residential services was never entertained, as each individual made it clear in their own way that they need to be with each other. Teresa managed to obtain and secure 2 residential openings in the same residence, and they are able to remain as lifelong roommates in their new setting. Finding one residential alternative is difficult enough, but 2 simultaneous placements is simply amazing. So thank you, Teresa, for putting the individual's needs and wants first and foremost. Great job. That's from Joanne Bates, the care manager director.
Okay. So we have another shout out that I'd really like to emphasize here that's hot off the press. It actually happened late last night. And in particular, the shout out is to Fifi Hansen, who's the care manager, along with Yukeni and Dione, supervisor and senior care manager supervisor, for their amazing teamwork in handling a crisis last night, where essentially a young woman on Fifi's caseload became missing in the Bronx. This is someone that had pretty significant disabilities and challenges, and became missing. This went on for many hours. Fifi stayed with the mother and enlisted the help of the 49th Precinct to do a search. Also, obviously, you know, in a crisis time where the mother was distraught, stayed with the mother, tried to help support her, engaged with, you know, others in terms of the search efforts. I have to say that Yukeni and Dione were supporting Fifi throughout the night. Dione had reached out to her off hours number to report it so we can make sure that the reporting got to OPWDD. It was really very much a team effort. And the really great news is that she was found very late in the evening in a hospital in the Bronx, and she is doing okay and she's safe. And then Fifi then continued to stay with the family and actually took them back to the shelter where they were residing to get back in, because we all know that after a certain hour, you know, the doors are closed. So Fifi assisted with that, and also very significantly assisted with the language barrier that existed with the mother, and was able to really support the mother. Truly commendable effort. Very proud to be involved with all of you as, you know, colleagues at Care Design. I think it really speaks extremely highly of your commitment and the team efforts that you do, and very impressive shout out. So this young woman and her family are very lucky to have Fifi involved, and it's only been a month too, from what I hear. So a lot has been done and really exceptional work. So thank you all. And I think that is our last shout out. And we're at the end of our session, so we'll start looking at the questions to provide answers to.
One of the things I wanted to share while Megan's looking up questions too, it's Ann, that just to know too that with the webinars, it's really important that the questions that you raise are shared with us as a leadership team. So it really gives us a sense of what's going on in your minds, what kinds of things you're struggling with. It helps us to keep our priorities in line. So your questions are not only important to raise at the webinar, but then also for helping us prioritize that we're focused on the right things to support you.
Okay, bear with us here.
You can blow it up by hitting that. Oh, maybe not. Maybe that was blown up. I'm sorry.
Okay.
Don't ignore me.
Want me to read it for you, Megan?
Yes, please. Okay. There's a question on floating holidays. How many floating holidays do we receive each year, and when do we receive them?
In our personnel policy manual, but I believe it's 2 per quarter, right? And you receive them each quarter.
Someone's asking for a calendar for all the holidays where CDNY will be closed, and that also should be, that's in our employee handbook?
Yes.
Right, so that's in our employee handbook. It does reference it there. And
But we can send something out
Yeah.
to people too, because that might be embedded. So holidays.
so holidays.
We don't have, we only have the, you know, handful of them that we are officially closed, but we will send those out.
And the question is, are we off on October 8th, Columbus Day? No.
If the answer is no, I have no idea.
No. Next question is there any change, in the Willowbrook mandate, to be converted to a life plan? The IM assessment continues to be a challenge and the deadline seems impossible. As of now, we have not, received any type of word of any change. And I'm not really thinking that we're expecting one because of the permanent injunction requirements and that, there's always that higher standard, for the Willowbrook, class individuals. So, I don't think we're going to get that. So I think we have to try to proceed ahead, to meet the timeline for the Willowbrook individuals.
Just want to mention something while you're looking for the next question around holidays. If the site in which you are based is closed for a holiday that is not a Care Design New York holiday, you can either use PTO, your floating holiday, or you can make other arrangements with your supervisors to work at an alternative site, or other arrangements can be negotiated. So you really need to work with your supervisors, and then care manager, regional directors if there are still questions.
The next question is when an individual becomes a Tier 4 for a temporary period of time, and we need to assist for a temporary period of time, is it okay to do overtime due to the demand the case requires now? I would just say to work with your supervisor, but I think everybody knows that, while we have some caseloads that are fairly large, we will be paying overtime where it's needed, to support the individuals on people's caseloads. There's some comments on the IM assessment and the some of the questions being invasive and, a challenge to be asking people doing, as they're doing the interview. I think, this has been raised before, and, we are trying to go through the process as best as we can. And, some of the questions, maybe can be framed a little bit differently as we go through them. I don't know, Danielle, do you have any examples in mind for this? Yeah, offhand, I can't think of any examples, but I know that, keep in mind it's a conversation. So I think it's, putting things in your words that, you think will work best for the individual and their family as we're going through the process.
And use each other, use your colleagues, use your supervisors, to say, I'm kind of struggling with how to ask this, how are you handling it, what might be your recommendations. It's all about using each other as a team to come up with the best solutions.
So the next comment is tied to Willowbrook, and it says, please be advised that the Consumer Advisory Board has informed Care Manager that all parts of the IM assessment have to be done with the CAB present. See, the Care Manager can't talk to staff from the day or residents without CAB present in person. Please give additional guidance on this, as this is the first we're hearing this protocol with CAB. So this is actually the first I'm hearing this as well. And we'll also consult with Louisa, who is our Willowbrook point person. This may be specific to the one particular Willowbrook, the Consumer Advisory Board rep involved. I'm not sure, but we'll look into that because I think that would be extremely difficult for us to really be able to operate with all that we have to do with those terms that they're putting on us. So we'll follow up on that specific situation and get more guidance out to people on it.
So just on that front, I think we'll put this on the agenda for discussion with OPWDD tomorrow, so we have consistency in approach. This could be a rep-specific challenge.
Yeah.
And, my inclination is to say that's not going to happen.
Yep.
And we got to do what we have to do. If they can't make it, that's on them. But we'll get further information from OPWDD just to validate this.
Thanks, Jim. That actually was Brooklyn where that concern came up. Okay, so continuing on, there's a question about, is there a plan in place to educate providers on staff action plans, IM, and life plans? And I think people know that OPWDD did do a training called Connecting the Dots. They had 2 sessions of it, and their training is going to be posted on their website for providers. that really is only step one, and I think really that's only training at a very basic level. So we have here talked about what we think we should do, because, you know, we're all a part of really needing to educate ourselves, but also ensure we have communication and education going out to providers we engage with as well. So one of the things we discussed was possibly putting together a provider directory or handbook or something, a guide that we would distribute, we would work on and include some key topics and provide information that'll help providers in terms of engagement and communication with people at Care Design. And that's something that I think we thought we would address that way. And then maybe we may want to do some type of webinar as well. And then I think, honestly, it's care managers' role, too, to continue to provide information and communication with the providers as well. And Danielle, I don't know if you have anything to add. Questions?
No.
All right. Okay, so someone commented that they're expressing issues sending emails to OPWDD. They state they're unable to open them. Now that ties to our Mindcast issue that we discussed earlier, and Jim mentioned too that he wants to have further discussion on this with Jim Brown, who oversees our IT, to see what other strategies or solutions can be in place. And we are aware of the concern as it ties to OPWDD, so we're trying to work that through further.
If you forward the email that you received from the OPWDD rep to itgeneral@caredesignny.org, then what we've been doing is having a member of our IT team follow up directly with that representative at OPWDD and troubleshoot with them how they can navigate the process. So that's been very effective. Unfortunately, when we have tried to have the representatives educate the rest of people, the employees at OPWDD, that apparently is not working very effectively. So we might have to educate one employee at a time. So if you have a problem with an employee, forward it to itgeneral@caredesignny.org, and we'll make sure that they get some help.
Okay, and that also is the answer for the next question, where someone was trying to send service amendments to OPWDD, and they're claiming they can't open it. So again, that's something that if you could reach out to the IT General at caredesignny.org with that information, we'll try to address that that way while we look at, you know, the overall issue.
For your, you know, everyday problems, still use the Help Me at caredesignny.org, but the IT General is specifically set up for, you know, Mimecast issues and very, you know, kind of high-level issues that need clarification. So if you have a problem with your Chromebook or your printer, it's still Help Me, but if you're having a problem with an OPWD employee not being able to open something, that's something that you can use to get resolution.
The next question ties to texting, and the question is, can I send the date of the doctor's appointment in a text?
I would say it depends on really what the context of the text message is. You know, if it's a date, I think that's fine, but if it includes the date and the provider, then I would be a little hesitant.
Okay, the next question is about phones. Our phones are requesting to update the new version, but we have no codes to do so. I'm assuming this is Care Design iPhone?
Yeah.
That this question ties to?
But we need to know specifically what. Maybe somebody can email helpme@caredesignny.org and kind of share that with the IT team and get some guidance on that. Is it a particular app, or is it the phone in general?
Okay, the next thing again is related to texting. Can I take a picture of an individual to send to a family via text per the family request?
Yeah, I wouldn't be concerned with that.
So the answer is yes, you can do that. Here's a question. Because of the serious risk related to unsecured emails and PHI, is there any way CDNY could look into automatically making all of our emails secure? OPWDD does this. So Lisa.
Yeah, so we've had quite a few discussions involving this. I've been in touch with Jim Brown, our security officer. You know, there's a few different options that we have discussed that we're looking into. You know, especially on a family point of view, there are some concerns about encrypting every single email that goes out, just because on the receiver's end, there is a process that they would have to go to retrieve it. But we are looking at possibly getting some dictionaries in place that will scan the content of the emails for certain keywords to either remind care managers to encrypt, or it will automatically encrypt those. So we are looking into some alternatives to better support care managers with the need for encrypting, but also not really put too much of a damper on your work, but also receiving emails from as a family member.
Thanks, Lisa. Next question is, when will the September mandatory trainings, Corporate Compliance Justice Center, be available in Litmos?
Those are in final stages, so they should be out, I'm going to say, I don't want to speak for Nancy, but I'm going to say within the next 2 weeks, everybody will receive those.
Okay, there's more comments about OPWDD not accepting encrypted emails. And here's a question for Dr. Byron. We have an individual who, due to an incident, is scared to go inside any facilities. We can't get medical appointments done. We're seeking a doctor who can come in the house to do an annual physical exam. The question says, do you make home visits? If not, do you have resources to help us in this matter? We've contacted a few places, and everyone's asking if he has Medicare, which if she has Medicare, she does not, and then they're not getting any response.
Email me with the particulars, so
Okay.
we can talk a little more.
So whoever submitted the question, the name's not popping up. If you could email Dr. Byron, email address is pbyron@caredesignny.org, and then he can see if he can assist.
BYRON.
Thank you. Question is, will CDNY be offering flu vaccines?
That is not something that we have talked about yet. It is something that we could potentially examine. So that's something we can bring up, but we have no plan at this time.
Insurance, everybody's insurance should cover a vaccine for free, though.
Yeah, I mean, it's pretty easy, too, to go to any kind of pharmacy now and get that as well. Yeah, they're very, very accessible. But I'll bring it back to the team and we'll discuss.
So there's a question, Jim had to step away. This question says it's for Jim, but we'll try to, back this up here if we can. So it says, I know we are a new agency, but I would like to know if it's possible that a CDNY agency letter can be generated for the individuals we serve residing in a residence, allowing them to obtain a New York State non-driver's ID. I have a list of individuals I served in my caseload that want the ID, and I'm willing to, work on this or whatever.
So I would say work with your supervisor or care manager, director, and we'll see what we can do to support getting what documentation and support is needed.
Yep.
So the individuals can get that.
Thanks, Ann. Comment, Chromebooks would work so much better if we could use Google Docs. Just an idea.
Yes, no, and thank you for that. That is one of the issues I didn't bring up about saving data and having to go through Google and having to go through OneDrive, and so that will be the conversation with Jim Brown. I don't know that solution will be able to be made, but it definitely is another topic, that we're hearing you loud and clear on the challenges of, the Google platform and the Microsoft platform.
The next question is, would CDNY implement a work-from-home policy? So we have, I think we discussed it, maybe it was in the supervisor webinar last week, that it is something that we're discussing internally. It's going to take us some time to land on what our policy would be, but we definitely recognize that that's something that we would like to, put together with certain parameters, of course, but as an option that we could look at rolling out at some point in the future. A question about Mimecast. Does Mimecast encrypt the emails we receive from people as well? So if I send something to a parent, they need to sign into Mimecast to read our email, and then they respond back. Is their email back encrypted as well?
They go through that Mimecast.
Yeah. So what Lisa Getman just said is if they go through the Mimecast queues or whatever, it would be. A comment, again, this ties to the Chromebook that Care Manager noted they're unable to save and work on the OPWDD ISS budget Excel template on their Chromebook. That's one of the things that's going to be discussed with the IT folks in the focus group, is the trying to, have the ability to work on those OPWDD forms, whether it be the Certified Residential Opportunities package or the ISS budget template. How are we, what needs to be done so that you can do that on the Chromebook?
The other thing that we're going to launch is a computer, desktop at each site. I can't say each site if there's only one or two of you, but a desktop unit each site so that you can use that in the interim as well to look at those, for those specific needs. So we will be deploying that pretty quickly out to the field.
There's one person that's commenting that they didn't get the reimbursement. I'm assuming this is travel, that they should have. And I would say to work with your supervisor, but we should be working with our accounts payable folks just to make sure that that matter gets taken care of.
Yes, I would email the same email that you submit your submission to and ask why that wasn't processed, and your supervisor should be able to help you, and they can continue to reach up the chain for assistance if needed.
So here's a question. Is there any idea of how we will deal with receiving the staff action plans at day 60? We're supposed to sign the life plan at 45 and distribute it at 60. Actually, no, but we're going to update folks on that. So we do have a little more flexibility. So Danielle knows our in-house expert, but I believe the life plan is, actually you walk it through, it's at day 60 that it's
For new enrollees?
No, just for, and I think it's just for anybody in general.
We're trying, we haven't gotten clear guidance. I know that for new enrollees, they talk about, and not the ones that were being given 120 days, but typically for new enrollees, it's 60 days to convene, to have the IAM conversation and to convene the planning team, and then an additional 30 days to complete, sign, seal, deliver the life plan. Now with reviews, I haven't seen like guidance that's specific to say that you have that additional 30 days. So we've been trying to get that from OPWDD, but I haven't seen it yet.
So we'll provide an update once we have, preferably something in writing from OPWDD on that. Okay, so we only have a few questions left that we'll work on getting back responses to people. So we do need to wrap up because we went a little bit longer. Thanks everybody. Have a great week. And remember, next week, no webinar. Our next 9 a.m. Thursday webinar is going to be on October 4th. And we'll still be doing the supervisor webinars weekly, and we'll be joining the supervisors at 10:30 today. Have a great week, everybody.
Thanks, everyone.
Bye.
Bye.
Well, it's, the 45 minutes and have it.